Good evening, everyone. My name is Shani Moulton, and today I will be doing a IV infusion setup for a patient. So, first things first, you're gonna get your micropore tape, right? You're gonna tear a few strips and put them because this is gonna be used when you're securing the vein. The cannula in the vein. Sorry, cannula in the vein. Next thing you're gonna have to do is you're gonna have to locate the vein. So to locate the vein, you need your tourniquet and the patient's arm, of course. You're gonna stretch your tourniquet very tight. The next thing you're gonna do, what you're gonna do is use your alcohol pads, right? So you take it out and you just do that in a circular motion or in the site of injection. After you clean the site of injection, the next thing you're gonna do is to take your cannula and do is remove the cap that's right on here. You never touch this because this should be sterile, it's going in the patient. And then you angle your hand. You anchor your vein, and then you angle your hand at a 15 to 30 degrees. Ensure that the bevel of the cannula needle is facing you. Just gently remove that cannula needle. Right, from the patient's arm, and the cannula will remain stick from the cannula needle that you have, and you're gonna close this. That's the port. Next thing you're gonna have to do is anchor this down into the vein because you don't want it shifting. So you're gonna put a piece of tape under it, piece of your micropore tape under here. After you've done that, so you want to prevent the air from going in there, you have to hang your IV fluid. Gravity is this way. And you're gonna pull your tube from the plastic and you dispose of that. You look for the puncture head and you remove the cap from here. You also remove this cap from the bag as well. And you use the puncture tip. The IV bag has a puncture drip tube. What you'll do is with the close controller, you have to check the fluid flow. So you remove the tip from here, and then you slowly release the drip controller. Alright, so you have perfect fluid flow, and that was the aim. So you're gonna close back the drip controller. And what you're gonna do is attach this end to your cannula that was safely secured in your patient's vein. Lock your IV drip tube in the patient's cannula. The last thing that you have to do, and this is based on the chart that you have for the patient or the doctor's order, you have to set the drips per minute. So what you're gonna do is slowly release the drip control to get that drip. So you see it's coming out drop by drop. So see right here, the patient is getting this medication. Sorry, you're sailing. After the patient's medication is finished, you have to remove from the patient's arm and dispose of all these and clean your workstation. And that is how you would do a setup of an IV infusion drip, whether it's normal saline or you're giving them TPNs or anything that's parenteral that has to go through the vein and done via infusion. This is how you would set it up.